Breast cancer remains the most common cancer among women worldwide, and the latest research paints an increasingly concerning picture. A new study by the International Agency for Research on Cancer, IRC, warns that breast cancer cases are rising at an alarming rate, with no signs of slowing down. The disease already accounts for a quarter of all new cancer diagnoses in women and is responsible for 15.5% of female cancer deaths globally. The study, published in Nature Medicine, provides an unsettling projection. By 2050, the number of new breast cancer cases will increase by 38%, reaching 3.2 million per year, while deaths from the disease could surge by a staggering 68%, exceeding 1.1 million annually. These numbers are not just statistics, they reflect a growing global crisis. Despite advances in medical technology and treatment, breast cancer continues to claim lives at an increasing rate. While some regions have seen improved survival rates due to early detection and better access to treatment, others, particularly in developing nations, face a much bleaker reality. The disparities in survival are striking. Women in high-income countries have a significantly higher chance of beating the disease, while those in lower-income regions face late diagnoses, limited treatment options, and higher mortality rates. In some parts of Africa, for example, the risk of dying from breast cancer is nearly 5 times higher than in countries with well-established healthcare systems. 1 in 20 women will develop breast cancer in her lifetime, and 1 in 70 will die from it. These figures are daunting, but they fail to capture the human toll of the disease. The families devastated, the careers cut short, the lives lost too soon. The burden of breast cancer is not only physical but also emotional and financial. Patients often face aggressive treatments, including surgery, chemotherapy, and radiation, all of which can have lasting effects on their quality of life. Many women endure years of anxiety, pain, and uncertainty, while others struggle with the psychological and economic challenges of the disease, particularly in countries where healthcare costs are prohibitively high. Perhaps most troubling is the question of why breast cancer rates continue to rise so dramatically. The study does not pinpoint specific causes, but experts cite a combination of factors: lifestyle changes, increased exposure to environmental toxins, delayed childbirth, hormone-related influences, and obesity. Urbanization and industrialization have also introduced new risks, from endocrine-disrupting chemicals in plastics and cosmetics to the widespread presence of microplastics in food and water. The modern diet, often high in processed foods and low in essential nutrients, is another potential contributor. The sharp increase in breast cancer cases cannot be ignored, yet many governments and health organizations remain slow to act on potential environmental and lifestyle-related causes. Compounding the crisis is the lack of widespread access to early detection programs. While regular mammograms and self-examinations have proven effective in catching breast cancer early, millions of women still do not have access to screening services. In lower-income regions, breast cancer is often diagnosed at an advanced stage, when treatment options are limited, expensive, and less effective. Even in wealthier nations, misinformation and fear prevent many women from seeking medical attention in time. The stigma surrounding cancer, coupled with a lack of education on the importance of early detection, leads to unnecessary deaths. If these trends continue, the world could soon face a public health catastrophe. The anticipated rise in breast cancer cases and deaths will put immense pressure on healthcare systems, straining resources and limiting treatment availability. Governments must act now to implement aggressive prevention strategies, increase funding for cancer research, and ensure that all women, regardless of where they live, have access to life-saving screenings and treatments. Public awareness campaigns must be intensified, emphasizing the importance of lifestyle changes, regular checkups, and early detection. The fight against breast cancer is far from over, and the battle is becoming more urgent. With cases set to rise dramatically in the coming decades, failure to act now could result in millions of preventable deaths. While medical advancements offer hope, they are not enough on their own. A comprehensive global effort is needed, one that prioritizes education, prevention, early detection, and equal access to treatment. Without immediate intervention, breast cancer will continue to claim lives at an increasing rate, turning what is already a serious health crisis into a full-scale epidemic.